Hello, welcome, and thank you for joining us for the virtual open house for our new breast center. I'm Dr. Lillian Erdahl, and I'm one of the breast surgical oncologists here at the University of Iowa Hospitals and Clinics. And we're really excited to tell you about the new breast center and take you on a behind the scenes tour. I'll be joined in a few minutes by one of my colleagues, Dr. Sneha Phadke. She is a medical oncologist here who treats breast patients with us in the breast center, and she'll be answering some of your questions. So we're really looking forward to having an interactive day with you. Go ahead and submit questions at any time, and that way we'll have a chance to answer as many questions as we can get to today. Before we begin, I do need to tell you that the broadcast is for informational purposes only. And so if you have specific questions about your personal health, please contact your primary care provider. And if you are interested in an appointment in the Breast Health Center, please contact us to arrange that. A little bit of background about our Breast Health Center. It's located on the 4th floor of the University of Iowa Holden Comprehensive Cancer Center. And as you'll see in the video, it's adjacent to the Stead Family Children's Hospital as well as Kinnick Stadium. We opened our center on April 25th, and we're excited to show you around that space. In that space, we have a team that treats breast patients with breast issues and particularly breast cancer exclusively. And we are excited to show you how we can do that in a multidisciplinary fashion in this new space. We have medical and surgical oncologists, radiologists, surgeons, and genetic counselors all located together. And that really helps us to use both our expertise and our technology and unique resources at the University of Iowa to provide the best breast care to the individual patient. We have recorded a video tour since we can't bring everybody in for a live tour. And so we'll show you that tour of the center. Since we're seeing patients actively, we can't take you in there today. And so we'll play the video, and then afterwards, we will be ready to answer your questions. Hi, I'm Dr. Lillian Erdahl, a breast surgeon here at the University of Iowa, and I'm excited to take you on a tour of our new breast center. One of the benefits of our new space is that we'll be able to see patients in a multidisciplinary team fashion with breast surgeons, medical oncologists, and genetic counselors all co-located in the same space. We have 16 exam rooms, and we'll take you on a tour so that you can see what those look like. In a moment, we'll go into an exam room so that you can see what the patient experience is like entering the exam. When a patient comes for treatment of cancer in our new breast center, they'll see a number of different providers, including our nurse navigators, whose role is to guide a patient from beginning of their cancer treatment along through their journey. Next, we'll enter the team workroom. As you can see, our treatment team has access to the patient rooms from a co-located space, which allows them to talk with one another about the patient care and nuances of multidisciplinary treatment. Located right across the hall from our team workroom is our breast radiology reading room, where our breast imaging radiologists are actively caring for patients. This co-location also allows our breast cancer team to come across the hall and speak with the radiologists and review images to ensure the best treatment plan. Again, you can see our Breast Imaging Center of Excellence is located immediately next to our new breast center, and we have the highest level of accreditation from the American College of Radiology. Often the breast imaging center is where a patient starts their journey with the diagnosis. Thank you for taking the time to join me on a tour of our new breast center here at the University of Iowa. We look forward to treating patients and seeing visitors in this new space. And now we're going to transition over to our expert panel where you can ask questions. So I hope everyone can see that this new space is really specifically designed for the care of breast cancer patients and allows us to give personalized care in a multidisciplinary fashion and in this one location where patients can see a number of different providers and not have to travel all over the hospital. I really am excited to have Dr. Sneha Fadki, one of our medical oncologists, join me. Thank you for joining us.
Yeah, of course. I'm excited to be here.
So we have some time to answer questions, and we want to see your comments and questions, and we'll try to get to all of them if we have time. I'm going to start with a question from Jean, and I think we can probably both comment on this, but Dr. Fadki, Jean asks, what is the latest treatment for a patient diagnosed with breast cancer?
Yeah, so I can start kind of talking about my part in breast cancer treatment. So as a medical oncologist, we're the doctors that give medications to treat breast cancer, and that can include chemotherapy, what we call targeted therapy, where the treatment is really just targeted at one specific gene or a specific protein. Immunotherapy now is something that we're using to treat certain types of breast cancer. And then we also use anti-estrogen therapy very commonly. And so for many patients, we use a combination of those treatments. And I think we also do a much better job now providing really good supportive care so that patients are able to hopefully enjoy a reasonably good quality of life even as they're going through their treatment.
Yeah, and I want to add on to the supportive care as well. I'm really appreciative of our survivorship team. And so, transitioning patients who have completed their care back to life and ensuring that we're dealing with any side effects or symptoms, including the anxiety that comes along with going through a cancer diagnosis, and how do I move on to the next phase of my life, if that's the stage that they're at. So I think having a model where we continue to see patients really for life, even if they're no longer on active treatment for cancer. And I think you highlighted that, with all those different treatments, it's not that there's a latest and greatest best treatment for any one patient, but it's really tailored to the individual patient, his or her goals, because we do treat men with breast cancer, and, and their goals really guide treatment as well as the type of cancer. Some of the things that we offer in surgery include partial breast radiation in the operating room. So for the right patient, we can complete the radiation at the time of surgery. That's for selected types of patients. And then we have been able to, again, tailor surgery to anything from a small lumpectomy and maybe avoiding axillary surgery in some of our patients, particularly women over 70, to for some of our patients who carry a breast cancer gene and have a hereditary breast and ovarian cancer syndrome. Maybe they're undergoing bilateral mastectomies to avoid future cancer risk. And we have a plastic surgery team that can help with immediate breast reconstruction to get the best long-term cosmetic outcome for our patients as well. It looks like we have another question. So Max asks, how do you think this new space is going to impact the experience for a caregiver who is with a patient during the visit?
So I think one thing that I like better about the new space is that it's larger, and the clinic rooms are big. They allow plenty of space for visitors. I hope one day we'll be able to accommodate more than one visitor once the COVID situation improves. But even now, I think that having that larger space is really helpful. The other thing is, there's some stress related sometimes to just navigating your way around the hospital. And so I think having, like you said, multiple specialists that are treating breast cancer all in the same area, sometimes you don't even have to move. You can just stay in one room. That can make things much more convenient and less stressful.
Yeah, I like the size of the space, and as you said, also the size of the clinic rooms. For us, we do ultrasound in the clinic often as surgeons, and so being able to easily maneuver the ultrasound machine in, I always used to worry about running over the family member's toes, and I have the space now that I can easily move the machine in and out and be able to easily complete those ultrasound studies. And I think The other piece is that we have more spaces where they can meet and talk with our nurse navigators or with our research staff or the genetic counselors if they have questions. So I think there's just a lot better workflow in that clinic space. Another question that we had wanted to talk about is, what is the role of the genetic counselor in the visit for a breast cancer patient? Can you tell us a little bit about, why genetic counselors are an important part of our team?
Yeah, I think there's a lot of reasons, and maybe you can discuss some of the surgical reasons that genetic counselors are important. From a medical oncology standpoint, we now have tailored treatments where if a patient has a certain hereditary mutation, we may actually have a medication that would treat it, or there may be a clinical trial available that the patient can enroll on for their particular mutation. I think outside of treatment of breast cancer, it's also really important to know if a patient is at risk for other cancers. So many of the mutations predispose a patient to multiple types of cancer, and that is important for their family members as well to know that, so that they can start screening or be involved in reducing their risk of getting breast cancer or other cancers early on in life.
Yeah, and I think as a surgeon, when we're talking with a patient newly diagnosed with breast cancer, often there's not one right choice to make in terms of surgery. For many patients, a lumpectomy with radiation or a mastectomy has equivalent cancer-specific outcome. So those patients live just as long whether they have more or less surgery. And being able to have expedited genetic testing to figure out if they're at higher risk for a second cancer can be one piece of helping make that decision. Because again, patients who have a known genetic mutation and higher risk for a second cancer will often, not always, but often choose to have more extensive surgery, even bilateral mastectomies. And knowing that maybe they don't have a mutation helps us to give a better risk assessment of how likely are you to get a second cancer. Because for many patients, having more extensive surgery has a statistically low improvement in how they do in the long term. One of the other things that I wanted to talk about is just how long we've been thinking about having really a co-located breast center space. I remember when I started at the University Hospital talking with Dr. Sugg, one of our other surgeons, about this. So, we've been wanting something like this for a long time, and it's just really exciting to get to this point, and we can't wait for all of you out there to see it. Dr. Fag, can you talk a little bit about multidisciplinary treatment? I think we say that term a lot, but what does that really mean?
So when we are referring to the disciplines, we're really referring to the different specialties that treat breast cancer. So with a new breast cancer diagnosis, often multiple specialties or multiple types of doctors are involved. So obviously surgeons and medical oncologists, but also radiation doctors, genetic counselors, breast radiologists, pathologists. There's many more that I'm leaving off, but so there's a lot of different disciplines involved in really the optimal treatment of breast cancer. And that's why we call it multidisciplinary treatment. And we also all get together once a week to talk about different patient cases so that we can all share our expertise and make sure that each patient is really getting the optimal care.
Yeah, and I think just as an example of that, we met a couple of weeks ago, the surgeons and one of our physical therapists who has a specialization in treating patients who've had surgery, including lymphedema, because we know swelling of the arm or breast is a risk after surgical treatment and radiation. And we talk even outside of those regularly scheduled tumor board meetings about, how can we provide the best care for our patients? Are we following the latest literature guidelines? Do we have all of the time to see the patients? Do we have the equipment available? How do we make sure that they can get the compression garments that they need if they're recommended? One of the other questions that we wanted to talk about was the nurse navigators. And, I mentioned it a little bit in the video, but a nurse navigator is often the first person who's talking to our patients on the phone saying, you just got this biopsy and now you have a diagnosis of breast cancer. and sort of here's what to expect. And I know I hear from patients all the time, do I get to meet the nurse navigator today? Is, Jean going to be here? Is Jennifer going to be here to talk with me? I think that they really give patients an advocate or a champion within the cancer center. Can you talk a little bit about how you might interact with the nurse navigator, or, what you see that role being?
Mm-hmm. So I think the biggest role that I have noticed of the nurse navigator is really coordinating care as much as possible and expediting care. So you're trying to get appointments for patients on the same day, multiple appointments sometimes, so they're only having to make, one or two trips. If a patient has, an urgent need to see someone, making sure that they get in quickly. Sometimes they'll even come talk to us personally and say, ask, can we fit someone else in? So like you said, they really advocate for patients. And so I think that's, from a patient perspective, I think something that would be very helpful, because the health system can be really difficult to navigate. And if you have no experience with, how to navigate the health system, or many people don't know how to navigate the oncology world, it can be really, really helpful to have that point person to help you through that.
Yeah. And a lot of what we've talked about has been cancer care after diagnosis, but you touched earlier on something I think it's really important for people to know that we offer, which is screening for patients at increased risk for breast cancer, risk assessment. So if you know that you have a family member who has a history of breast or ovarian cancer or another cancer, they can come and talk with someone in our cancer center about, what does that mean for me? Do I need to have genetic testing? And so when it comes to our breast clinic, we actually follow a number of patients who, either because of a biopsy result showing a high risk lesion, so not cancer, but something that tells us that they have an increased lifetime risk of cancer, or based on their family history or a gene mutation, are undergoing accelerated screening. Many of those patients are coming in every 6 months to have a mammogram or an MRI and a clinical breast exam. So we do quite a bit for cancer prevention and screening. Can you talk a little bit about medications to reduce the risk of breast cancer?
Yeah, so for people that have a high risk for a future breast cancer, for whatever reason, there can be a multitude of reasons someone might be at high risk for developing breast cancer. We can offer anti-estrogen treatment, which, like I mentioned before, is often a treatment for someone who's diagnosed with breast cancer, but it can also be an agent that's used to reduce someone's risk of getting breast cancer. So the most common type of breast cancer is one that expresses hormone receptors, or that is responsive to hormones like estrogen. And so by giving an anti-estrogen, it reduces the risk of that most common type of breast cancer.
Here's another question. So Samantha asks, have you heard of Margin Probe? And if so, what are your thoughts on the device? Thank you for that question. So Margin Probe is a commercial device, and it's really something that's used in the operating room. And it's a technology that is intended to try to help surgeons decrease the risk of having a positive margin at the time of a lumpectomy, usually. Sometimes could be considered in a mastectomy, but when we do a lumpectomy, we're removing the tumor with a rim of normal tissue around it and preserving most of the breast. And so there are a number of different ways, other commercial devices, as well as surgical techniques that people have used to try to lower that rate of having to go back for another surgery because we didn't get a clean margin on the cancer. What I can tell you is that the research that came out on this showed that it reduced the rate of positive margins from something around 30% to around 10%. And it also has a significant false positive rate. So where the device is placed on the tissue and the device says, oh, there's still cancer here, but it turns out when the pathologist cuts through that tissue that the margin was clean. So that was one of my concerns about, again, any technology is, how accurate is it? And when we looked at our margin rate, our rate of positive margins was around 11%. So kind of right at that 10% range. So it was unclear that there was benefit in our practice to adding a device to scan the margin. I tell patients, I don't want to have to go back. My goal is to have a negative margin when we take you to surgery. But if you look across the country, I'm not aware of any practice where the rate of positive margins is 0. And we're trying to balance removing enough tissue to get the cancer out with giving a good cosmetic result so that the breast looks like a breast when we close up the incision after lumpectomy. We use a number of techniques, including shaved margins, as well as intraoperative x-rays. We often localize with ultrasound. So I'm using an ultrasound in the operating room to look at the tumor and the edges. And then we have a couple of different devices we use, including radioactive seed and wire. So using the appropriate localizer device so that we can be precise about removing the correct tissue and saving, preserving the rest of the breast tissue. So I think, margins are important, and we are continuing as a practice to always assess, what devices, what technologies do we need to be using in the operating room and in the clinic and in radiology to provide the best care. The other thing that we often talk about in the Cancer Center is clinical trials, and it's one of the reasons that we have a National Cancer Institute designation at our Cancer Center. Dr. Fadke, can you talk a little bit about either some of the clinical trials we offer or how clinical trials help patients either now or in the future?
Yes, so clinical trials are one of the most important parts of oncology care in my perspective, because we really can't move cancer care forward without them to know whether the next thing is better than what we have now. So clinical trials are super important, and basically they are experiments. We're testing whatever the standard of care is now with the potentially next newest best thing, and then comparing the outcomes. Did the new thing work better? Was it the same, or was it worse? And so there are different phases, but patients enroll on these trials. I think one of the common concerns from potential clinical trial participants is that there may be a placebo involved, and in oncology trials there often is not, and most of the time the control arm or the non-experimental arm is whatever the standard of care treatment is at that time. So I always encourage patients to enroll on the clinical trials that we have here. We have a few looking at different types of hormone medications, and then we have several in the metastatic setting as well. Whether we have trials here or somewhere else, I think that those are always a good option for patients to consider, at least think about. And sometimes we don't know if the patient will benefit. That's one of the questions. But I think it's a very brave and altruistic and kind thing to do to try to, improve upon our knowledge for the next generation of patients.
Yeah. We have still a little bit of time left, so if you haven't had your question answered and you have a question out there, please go ahead and submit that. And then I do want to tell people that some of the trials we participate on are multi-site trials. So one of the things that we look at in cancer care is you need often a large number of breast cancer patients to be able to draw a conclusion. And one of the reasons is we have such great treatment that most women diagnosed with breast cancer do well with treatment. And so we also participate in some surgical trials, for instance, looking at how much surgery do women need in their axilla, how many lymph nodes do we need to remove, particularly in those patients who have undergone chemotherapy prior to surgery. Can we decrease the risks and harms of treatment without impacting the cancer-specific outcome with patients still doing just as well? And so we're looking at radiation versus additional surgery in that particular case. And then we actually are participating in a trial looking at for non-invasive cancer, or what's called DCIS, ductal carcinoma in situ. Is there some of that is never going to turn into invasive cancer, where patients might not need to undergo surgery at all? But it's important, as Dr. Fadke highlighted, to look at these in a controlled way so that we can draw conclusions as a medical community about potential changes to our practice. I'll come back to our breast center, since that is the reason we wanted to talk to everybody. Dr. Fadke, how do you think that this space will lead to better care for patients?
So I think the biggest way is just the coordination of care. And it's obviously a very highly stressful time after a diagnosis of breast cancer, and being able to see multiple of your doctors in one space, I think, will really help with lessening anxiety and having people feel more comfortable. I think we did a pretty good job before of coordinating care. I mean, we had our tumor board once a week, and I felt like we, talked to each other a lot about different cases to make sure that we were on the same page with the best treatment for a certain patient. But this will only make it even easier to do that.
Yeah, and I really hope that everybody can come see the space soon, because I also I'm so proud of our team. A lot of time and effort went into designing a space that would be functional for us seeing patients. Again, the room size, the bed layout. I'm really excited about the whiteboards. I know it seems like a small thing, but being able to visually explain what's happening to patients really helps me in the clinic, and I hope helps patients to better understand what's going on in their bodies and why we're recommending specific interventions. And I think the artwork and just the comfort in the space for me has made it really a joy to go there every day.
Yeah, it's got a great view of Kinnick and lots of big windows, lots of sunlight. So I like that too.
Yeah. So when you come for an appointment, or if you're able to come and visit us, it is on the 4th floor of the Holden Comprehensive Cancer Center. And the closest ramp there would be ramp 4. So if you park at ramp 4, you can get directions from the ramp over to elevator M and up to the 4th floor. If you've been to breast imaging before, it's right next to breast imaging. So again, it really allows us to lessen the travel for patients, as well as pop back and forth to speak with the radiologist directly about patient care and whether or not we need additional studies and how they might inform the treatment plan. Dr. Fedke, I wanted to ask you another question about genomic testing, because I think that's one of the things that has changed breast cancer care, specifically for women with early stage estrogen sensitive tumors. Can you talk a little bit about how genomic testing works and how it might inform you of what the best treatment is for a patient?
Yeah, so the first question we started with was, what's the latest treatment for breast cancer? And I feel like genomic testing has really changed the way that we think about specifically chemotherapy for breast cancer. Decades ago, I think most patients were treated with chemotherapy because we really did not have a way to figure out which patient would benefit. And so a lot of patients got chemotherapy and maybe they didn't need it. And so now we have tests that we can do on the tumor specimens themselves. They are sent to specialized labs that look for certain genes that are associated with, a fast-growing or aggressive tumor. So, and those are genes in the tumor, not genes the person was born with. And then the test will put all those results into an algorithm and give you a number, and that number is associated with a risk of recurrence. So only patients who have a high risk of recurrence benefit from chemotherapy for the most part. And so it really saves thousands of women every year from getting chemotherapy that does not benefit them. And so really the purpose of the test is to find that small group of women that does benefit so that we don't deprive them of a really beneficial treatment.
Yeah, I think so much of our care is individualized, and in order to provide that, it takes a little more time, which means that patients are waiting for more tests, maybe after surgery, so that we can give them the best recommendation. But I think the potential to avoid risks and harms to those people who don't benefit from a treatment is one of the changes we've seen just over my career as a breast surgical oncologist. I have another question from Barbara. Barbara asks, do we come to the new breast center for our annual mammograms? So we perform screening mammograms at the breast imaging radiology on the 4th floor. They're right next to our new breast health center. They're, again, kind of right next to each other. So it'll be the same place if you've been coming to the main hospital. We also still have imaging at the Iowa River Landing site. And that's a place where a lot of patients I know prefer to get their screening imaging because it's a little bit easier parking and getting in and out for screening imaging. I will put in a plug, as I mentioned in the video, that we are a breast imaging center of excellence. And where you get your mammograms does make a difference in the quality and the rate of diagnosis of cancer and screening. And we also use a number of other technologies, including both handheld and whole breast ultrasound and breast MRI. And it's important to talk to your provider about your risk when you're talking about screening imaging as well, because there are some patients who benefit from additional screening beyond mammogram. I want to thank everybody for joining us today. We are just really excited to have you come in and visit us in our new breast health center. And if you do have a need, a breast concern, symptom, to please call and let us know. Otherwise, we'd love to see you as visitors, as Dr. Fadke mentioned, as soon as we're able to do so in these challenging times. Dr. Fadke, are there any other sort of last comments that you want to tell people about working at Holden, or what's important for them to know about breast health?
I think my favorite thing about working at Holden is just the expertise we have across specialties. Everyone here is a specialist. Everyone who works in the breast health center is a breast specialist, and so they're at the cutting edge of new procedures, new technologies, the newest tests for determining different treatments, and really providing as personalized of care as we can. So it's great to work in a place where you feel like all of your colleagues are experts at the top of their game.
Yeah, I will just echo that one of the things that makes me excited about coming to work every day is the people I work with, and both that I enjoy working with them, but also that they are really dedicated to our patients. And, I think I hear that back from patients, how much every member of the team really is invested in their care and trying to make the experience of going through cancer treatment as comfortable or as pleasant as it can be. I know it's a difficult time in somebody's life. Even just coming into a medical appointment can be scary, and I feel like our team members all know that and try to do whatever they can to help the patients get the best treatment and also feel cared for in our space. If you joined the stream after we started, the full broadcast will be available soon at the same link. And there's always more information on our social media channels and our website, uihc.org, about the latest and greatest things that are happening in breast cancer care, as well as the rest of our patient care resources here at the University of Iowa. Thank you all so much, and have a wonderful day.